Imagine waking up one morning and not being able to see clearly out of one eye. Well, that's exactly what can happen to people if they've suffered a stroke of the optic nerve, known as non-arteritic anterior ischemic optic neuropathy, or NAION for short. Today on the IQ podcast, I have a very special VIP guest who is a patient of mine who suffered an episode of NAION. And he went on to participate in clinical trials as well as write a book about his experience with NAION. So stay tuned for this week's episode of the IQ podcast with my very special guest, Frank Bruni. Welcome, everyone, to another episode of the IQ podcast, where you can gain insights into vision health and brain health and raise your IQ. I'm your host, Dr. Rani Banik, and today we have a very special guest on the podcast. And I always think of my guests as special, but this guest is extremely special. He's a VIP in my mind. Frank Bruni has been a prominent journalist for more than 3 decades, principally at the New York Times, where his various roles have included op-ed columnist, White House correspondent, Rome bureau chief, and chief restaurant critic. He was the Times' first openly gay op-ed columnist. Frank has received many accolades and has made frequent television appearances, including On The Daily Show, Late Night with Seth Meyers, and Real Time with Bill Maher. He also writes books. The Age of Grievance, published in late April 2024, became his 5th New York Times bestseller. His previous bestsellers include his memoir, The Beauty of Dusk, about his medical, emotional, and spiritual journey after a stroke in late 2017 diminished and imperiled his eyesight. He also wrote Where You Go Is Not Who You'll Be, about the college admissions mania. In July 2021, Frank became full professor at Duke University. He continues to write his popular weekly newsletter for the Times and to produce occasional essays as a contributing opinion writer. Let's welcome to the IQ podcast my VIP guest and patient, Frank Bruni. So I am so excited to bring on Frank Bruni as our guest for today. So I've known Frank now for a few years, and he is also a patient of mine. So again, I'm really honored that you've come on the podcast.
Thank you for having me, and thank you for all the help you've been to me over the years.
Oh, it's my pleasure. I'm so honored to have met you, and I'm glad to have been part of your journey. So, as part of this podcast, oftentimes I bring on providers to share their strategies for how to treat certain conditions. And sometimes I bring patients on as well to share their side of the story, because I do think it's important to get both sides to better understand vision health and how we can also help our patients better if we know what's going on in their minds. So I would love for you to begin by just sharing what happened back in 2017. Like, what did you experience? I know you shared a lot in your book, which we'll talk about, but what was going through your mind when this first happened to you?
Well, I mean, I woke up one Saturday morning in the middle of October, I think it was 2017, and something was wrong with my vision. And I thought like maybe I had gook in my eye. I thought maybe I had had too much wine the previous night. I thought it would just go away. And it was a good 36 hours before I kind of accepted that something more than incidental had happened. And I figured out during that 36 hours that the unbalanced, patchy vision I was experiencing was in fact all a function of my right eye not seeing almost anything. And I, in short order, I went to my normal ophthalmologist who said, no, you need to see a neuro-ophthalmologist. Am I getting these terms correct? I always
Absolutely,
think I'm
yes. Yeah,
um,
absolutely.
and I found my way to one, not you initially. You and I met later when I was enrolled in 2 different clinical trials of things that the NIA had permitted to go to trial. Both trials, I think, and you would know more about this than I, were aborted because the results were not so good, and neither of those treatments ended up panning out and being circulated as an actual effective treatment for NAION. But anyway, I was diagnosed within about 2 weeks with NAION, and I'll leave it to you to spell out that acronym for listeners. And, I learned from you and others that I would probably never get any of the sight I'd lost in my right eye back. And indeed, I have not. But over time, and my vision loss was central vision. As you know better than I, frequently with NAION, which is a sort of stroke of the optic nerve, frequently it's peripheral vision that's lost, which I think is probably the more fortunate occurrence. Mine was central vision. But I have learned over the years to operate quite well with, and correct my terminology if I'm wrong, with monocular vision. And that's my story in a really condensed nutshell.
Yeah, I want to dive a little bit more into initially when it happened. So you noticed that it was blurry. Was it changing or was it pretty constant? Like since the onset, when you woke up that first morning with it, in those first 36 hours or the first 2 weeks even?
Because it's 7 years ago now, it's really difficult for me to remember. So I could be wrong, but I believe that in the first 72 hours, it got worse. And then it stayed the same and has never changed. But again, as you know better than I, because you've dealt with so many patients in my situation, well, it's never gotten better according to eye tests I take when I was, there were a couple of years there over which the clinical trials I was in that you were one of the supervisors of that site, I guess. And again, forgive my terminology if it's wrong. As those tests proved, it was never getting better. Because I was having my right eye, left eye, both eyes tested all the time. But it almost feels at times like it's gotten better because my brain has over time gotten better and better, never perfect, at editing my right eye out of the equation, or at kind of adjusting for my right eye's failed and botched attempts to get in on the vision. But when I close my left eye and try to see through my right eye, it's clear to me that it in and of itself there's never been any improvement, which I think is fairly consistent. I will tell you the most kind of stark thing to me is there are times I forget that I have this quasi disability because I've been living with it for so long and because I've adapted. And that's the kind of great thing you learn, is how adaptable, how nimble we all are in certain ways. But when I moved about 3 years ago from New York to North Carolina, and I had to exchange my license and I had to get a fresh vision test for reasons that make no sense, because you can legally drive with one-eyed vision. Their eye exam thing was this sort of set of binoculars, or like a machine with binoculars. And they didn't tell me how many lines I was looking for, what I was going to read. And they said, read the first line, and I did. And then they said, read the second line, and I did. And they said, why did you skip from the second line to the third line? And I said, I didn't. There are only 2 lines here. And then I said, wait a second, I think I know what's going on. Is the first line left eye, the second line right eye, and the third line both eyes? And they said, yes. And I said, well, and I literally I could see none of the line. My right eye registered the letter of it.
Yeah, so it's almost like a band right in the center where you're missing your vision, right?
Yeah, that eye test was almost like perfectly synchronized with the vision I'm missing. And it was just a stark reminder, because I forget that I've lost that. I forget like how severe the loss is. And then there's something like that, and it's like, wow, I didn't see a single letter. I didn't see a smudge of a letter. I had no sense there was a line of letters there.
Yeah, and so I keep wanting to go back to the initial, when you had first lost the vision. I remember meeting you for the very first time, and you had come in again as a potential candidate for this first clinical trial for non-arteritic anterior ischemic optic neuropathy, which is NAION.
Well done. Well done.
I say it super fast. I try to get my family to say it super fast as well, as a tongue twister. But as a provider, so I'll just give you my perspective. So I see a lot of patients in one day when I'm in the clinic, and sometimes there are 30 patients that we have to get through, and so unfortunately we don't get to spend that much time with each patient. But I saw that look in your eyes of just fear and the uncertainty of what was going to happen, and I did spend more time with you, also because you were thinking about enrolling in the trial. As a patient, what has been your experience kind of again, I know it's been, 8 years, 8 years now since this all happened. Going back to the beginning, like your interactions with providers, what was your experience, and what advice would you give us as providers? There are ophthalmologists, optometrists listening to this podcast, of how we can do better in terms of helping our patients get through this very difficult time in the very beginning.
Well, for starters, be really careful with the information you give out. And that's not so much about you. as about the first neuro-ophthalmologist I saw. If you saw fear in my eyes, it's because before you and others corrected the information, and I should say I was very lucky because I am a journalist, because I realized I might write about this and I could legitimately make calls to experts and get them on the phone, because I wasn't just kind of exploiting them. I mean, I ended up quoting some of them in stories I wrote. But so I was able to, I forget the name of your mentor at Johns Hopkins, who was wonderful.
Yes, Neil Miller. Neil Miller.
Neil Miller. I to this day, I will occasionally exchange emails with Neil Miller. I'm very, very lucky and privileged that way. But the very first doctor I saw, the first neuro-ophthalmologist, this is in the book, so I may be getting the exact percentage wrong, but I'm pretty sure I'm right about this. She told me there was a 40% chance, according to the literature, that what had happened to my right eye would happen to my left eye. So I was being told, and because the iteration of NAION in my right eye is, as you and I have talked about, fairly severe. There are a lot of people who have less, if you took what happened to my right eye and you put it in my left eye too, I'm then legally blind. And so she was telling me there's almost a 1 in 2 chance you'll end up legally blind. That turns out to not be correct, or at least not to be the prevailing wisdom. As you know, some people think 20%, some 15%, but the literature is still evolving. We don't really know. So I was scared in part because I'd gotten dissident rogue information. And so I would implore doctors to be very careful, because at the moment that you're giving a diagnosis and laying out the future for a patient, you've got someone who's rapt and RAPT, and extremely anxious. And if you're giving out information that is on the most pessimistic end of the spectrum of possibility, boy, you should really say that. The same doctor told me that flying in an airplane would be a danger forevermore, except if I flew with oxygen, and that it was as simple as getting a doctor's note and the airline would provide the oxygen. 100% wrong. When I got this
that's in the perfect ideal world, you would hope that would happen, but
100% wrong. We don't have time for me to go into all that I learned was wrong and how much time I wasted on the phone with Delta and other airlines. But you got a patient who's in a vulnerable, scared position, and there's another piece of wrong information, and it is so important not to give out information in a kind of helter-skelter, unthought out way to someone who is processing so many changes in their life and so much that you are guaranteeing that whatever anxiety he, she, or they are feeling is going to be exponentially increased. And the other thing that happened across the board is, I think to this day, that the primary challenges in getting a diagnosis like NAION, especially because there is a risk that the other eye will become involved, 15 to 20%, because if it's a fairly serious iteration, you are dealing with compromised vision that's real and that's scary and that needs some effort and adjustment. I think the greatest challenge is psychological. And nobody, and I encountered so many professionals and doctors, nobody ever said to me, do you need a referral to therapy? Like, how are you coping with the emotions? How are you doing mental health wise? I think that needs to be integrated into care. And it's shocking to me that it's not there at the get-go.
It is important for us to give enough information, but also give a balanced view, not just to remember what our worst cases were that we've seen and then share that with our patients, is really to give the spread, as you said. And also, I encourage my patients always to go to reliable sources online. So not just to Google what they have, but to go to very specific sources so they're getting vetted information. I think that's all. And now there's plenty of them. It's not that, they're few and far between. Now we have so many reliable sources that we can send our patients to. In terms of the mental health.
If I can just interject here, I want to say, because I want to give you credit. One of the reasons I'm so grateful to you, and one of the reasons I admire you, and if people say, who should I go see, I often mention your name. You were extremely thoughtful about that. I during the trials, there were a couple of times I think I emailed you or called you because I had like a question like, is it really dangerous if I go to the Aspen Institute and I'm at 9,500 feet? Is it? And you were extremely careful and thoughtful about saying, whether you had a strong feeling about it or not, you occasionally, I may be using the wrong terminology here, you occasionally said, well, let me put that out on this list serve or whatever. Like you
Mhm.
would put it out there to doctors, and you would tell me exactly how you were coming by the advice you were about to give me. And you were not doing it in this kind of unilateral, godlike way. There was something very humble about the way you did it and very thoughtful. And that was so steadying, so emotionally and psychologically steadying. And I think you're a model for how physicians can handle it. On the other hand, I also appreciate it because I know that took you time, and I'm well aware of how precious a doctor's time is and how many patients you're trying to see, so you can help a lot of people at least a little bit. But that was
Mhm.
very useful and considerate and emotionally steadying.
Well, thank you for that, and I appreciate your support with all of that. The truth is, NAION is fairly rare. It's not something we see commonly. It's not something we see even as a neuro-ophthalmologist. Not even every week do I get a new case. It's maybe 2 cases a month or so. So there isn't that much written about NAION, and a lot of it's conjecture. We don't know. And so that's why I do think it's important, for rare conditions to pool information and to kind of survey some of our colleagues and ask, okay, what have you done with patients? Like, what are the recommendations for flying? There aren't any, guidelines that are set in stone. What do we tell our patients? How should we counsel our patients? I think it's important to reach out to your network and incorporate some suggestions like that. Now, the second thing that you said, I want to come back to that, which is the mental health aspect of things. Losing vision is frightening. It's devastating. Whether it's from NAION or something else, even if it's from dry eye, where people don't see well because they're suffering from dry eye, their vision may fluctuate on a day-to-day basis and they can't function. It can really impact so many aspects of their daily life, including their mental health. And I think you're absolutely right. We as eye care, specifically eye care providers, need to be aware of that. And there have been countless times when I have brought in some of my colleagues in the mental health space, like, can you please help? Can you please assist? Because this is out of my realm of expertise. So it's not what we're trained to do, but we can certainly tap into resources and our colleagues and get our patients the help that they need. I think it's really, really important. And unfortunately, I've even had some patients who become depressed over their vision issues, anxiety, even suicidal because they've lost significant vision. They don't know what to do. It's an issue and it's not talked about, and we need to talk about it more. So thank you for bringing that up. The other thing I wanted to ask you about was, you mentioned you were part of 2 clinical trials. Again, it was several years back now, but what were your thoughts, deciding to enter into these trials? Was there hesitation? Was there like, I'm just going to go for it because if anything can help me, I'm going to do it? Like, what was going through your mind in this decision-making process?
I had no hesitation. I was conscious of and bummed about the fact that I knew it was going to mean a lot of time, and I was leading and continue to lead a crazily committed, overscheduled, really, really busy, 70 hours of work a week life. But it felt to me like if I was lucky enough that in both cases I screened in, like I was in the recentness of what happened to me, my age, the fact that I didn't have other medical complications. I realized rather quickly that it was a privilege to meet the criteria to be admitted into these trials. I didn't. This didn't almost make me not do it, but I was conscious and a little bit bummed about the fact that the only way you can do a trial. I have enough of an education that I know what scientific. I know what it's about. I know there have to be people in a placebo group. I know that I may end up in the placebo group. I know that's the only way that scientific progress is made and all that. So I was conscious of and bummed about the fact that it was going to mean a lot of time and I might not even be receiving the treatment. But the possibility that I would be, and that it would be effective, the possibility that I would be participating in the development of an effective treatment, not just for me, for other people, it seemed to me, at least the way I'm rigged, a no-brainer that I would do it.
Mhm.
I would find the time
Yeah.
and I would do it. I mean, the first trial was shots directly into the eye. So
Mhm.
of course that gave me pause. And of course that's pretty unpleasant. Although I only had one needle in my eye because it turned out this is way too involved. I figured it out because I was doing internet sleuthing and all of that, that apparently there's no justification in a trial for piercing a patient's eye and delivering nothing. So the first time I went in, it was hideously painful. The next two times, I just felt a little pressure on my eye, and I learned that the placebo in that case was kind of a blunt nose needle tapping the
Hmm.
exterior of the eye. So I used to fool around with Doctor, I think his name was Gentile, who was the
Hmm.
person who administered. I used to fool around. I say, I know you're not going to confirm this for me, but I know second and third time I just got placebo because it didn't hurt. Um, the other trial was even more, it didn't hurt, but it was more of a commitment because it was me administering, I think it was twice a week, like every third or
Yeah,
fourth day,
twice,
me
twice.
administering as if I was taking pregnancy hormones. I had to learn, you helped teach me. I had to learn how to load a syringe, get
Self-inject,
the
yeah.
air out, inject myself. And I think that took place, was that over 6 months or 3 months? It was a
It
long,
was 6 months. Yes.
right? It was 6 months of having these vials in the fridge at just the right temperature. When I traveled, I had to buy this special kind of refrigerator thing. When you were going through
Hmm.
TSA, you had to explain what was going on. And but there again, on the chance that I was getting a meaningful treatment, on the chance that I was helping, if not myself, someone else 5 years down the road get a meaningful treatment, I also found, and I mention this because it may apply to other people and be helpful, it can be extremely psychologically useful to be doing something. Like you're told at the
Hmm.
outset, there is no effective treatment for this. We've got nothing. There's nothing that we know that we're on the cusp of, like if you wait 2 months. And you're told at the outset that the overwhelming majority of people never see improvement in the affected eye, though they get better and better at navigating life with that compromised vision. This was one thing I could do that felt like some agency.
Hmm.
And in some ways, the extensiveness of the commitment, the twice a week shots and the vials in the fridge, or the willingness to kind of have an injection in my eyeball for the first trial, in some ways, that even made me feel even better. Like I
Hmm.
wasn't just being given some agency, I was actually kind of doing something committed in the
Hmm.
service of, if not my own improvement in general in this kind of space. And I found that meaningful and mood elevating.
Hmm. Yeah. So as a provider who runs these clinical trials, we are so appreciative of our patients who decide to participate in them. It is not an easy decision by far. I mean, the first trial was injections into the eye, intravitreal injections. The second trial was self-injection. So these were invasive procedures that we're having our patients do without knowing, number one, whether it works, because this is what the trial is intended to do, to figure out if it works, but also without knowing whether you're getting the placebo or the real thing. So we're so grateful for our patients. And it does take, a certain mindset to want to participate in a trial. And so again, thank you for doing that. And unfortunately, neither of them showed benefit. One of them definitely did not work. We had almost 800 patients enrolled across the world, and unfortunately, the drug did not work. The second trial, unfortunately, was aborted early because they
Yeah.
had done an interim analysis and they found, again, it was not effective. So unfortunately, those two trials didn't work for NAION. Perhaps someday in the future, we will be able to offer our patients something, maybe in the line of stem cells or gene therapy. We don't yet know, but for now, Frank, like I know that you've it's in some ways come to terms with this. You wrote your book, which is something I highly suggest everyone read. The Beauty of Dusk, about your journey. It has a lot more information about what you went through, but also you interviewed a lot of people who've also had other experiences with vision loss. What made you decide to write this book? Was this kind of a personal sharing, or did you want to reach more people who've experienced vision loss? What was the impetus for writing this?
I mean, I think it was part of it was just reflex, right? I mean, I'm a writer. I'm sorry, my dog is barking.
It's okay.
um,
Can you include her in the conversation?
I know, and she's a whole chapter of the book because, in fact, getting her was part of my recovery in a sense. She was kind of a big part of. I stopped delaying doing things that were on my kind of, I'm going to do this soon, and I was going to bring a dog back into my life at some point soon, and almost anything that I wanted to do soon, I started to do really soon because, well, there's nothing life-threatening about NAION. It was a kind of reminder that you have no idea what medically speaking, physically speaking, is coming down the pike. Writing a book, it was when I was going through this kind of one thing, I kind of feel like if something interesting, meaningful, dramatic is happening in your life and you're a writer, you might want to make use of it. I was lucky enough in the kind of last decade of her life to be good friends with Nora Ephron, very famous writer and then film director. And Nora, from her mother, who was also a writer, got the phrase and lived by the credo, everything is copy. And copy is an old-fashioned newspaper term for material, for words. And everything is copy is sort of, I think a lot of writers live by that. Like you want to make use of the interesting, quirky, resonant things that happen in your life. And so without necessarily thinking I'm going to write a book about this or I'm going to write whatever, I just, as I was going through the first weeks, months of it, I had Word files on my computer called iDiary1. When that got really long, iDiary2. And I was just kind of writing down what was happening and what was frustrating about it, what was fascinating about it, when something encouraging happened. And I realized at a certain point, like I've got the beginnings of a book or at least a kind of long magazine piece here. And I was also reaching out to and talking to friends who had been through medical crises. And I was taking notes on that. And so I wrote a long piece for the New York Times about what I was going through and what I'd been through. And it had a lot of readers. And I got my literary agent, because I'd done previous books, got calls from editors saying, this feels like the beginning of a book. And so I wrote the book, and it was a reason to reach out to and meet more people who'd been through medical crises. And I wanted to write something that shared my own story, but also brought people along with me as I educated myself, not just on what people with vision loss had done, although they're probably the majority of the case studies, for lack of a better word, in the book, but people who'd been through. I have a close friend from college who was diagnosed with Parkinson's very early in life, and it was very severe. And she's almost a whole chapter of the book. Because those sorts of medical and physical curveballs, each one is different, but in some ways they're all the same. They're about being presented with limits and challenges and having to figure out how to see them in a different way, how to navigate them, how not to be so spiritually and psychologically and emotionally capsized by them, that you lose a good quality of life. And so many of the people around us have been through these things and have so much wisdom that we never tap. And that was a great overarching lesson for me, is how much wisdom and great advice is all around us among the network of people we know and the network of people right beyond them. And we too infrequently tap it.
Well, I can tell you that I've had so many of my patients tell me that they've read your book, and your insights, the short stories you've shared, have helped so many people around the world. So thank you for doing that. And I think also an important message of the book is at the end, I think you say, watch me fly. And I think that's a very, very important visual, that despite this experience that you went through, you are still able to do so many things and still enjoy so many things. So I think that message that has resonated with so many people is, yes, there can be a certain period of adapting to a change, a health issue, or whatever it is, a change in your life, in your body. But then beyond that, you can still continue on and appreciate and be grateful for all those other things that you can still do. So I think it's a really, really important message.
Thank you. I hope so. If it's helped people, that's just wonderful to hear.
Yeah, and people, again, not just with vision loss, but other challenges as well. So it's really been impactful. Well, Frank, I know that you're very busy, and I really appreciate your time spending this half hour with us on the IQ podcast. Is there any kind of last words or comments or advice you would give people, whether they're eye care providers or perhaps patients listening, that you'd want to leave them with?
Well, I would just echo what you said about sort of kind of working your way toward a place of gratitude. I think there's a fundamental choice we all make in life, and this is true even before you come upon a medical crisis, and everybody will have a medical crisis, which is you can focus on what you don't have and what you've lost and what's been taken from you, or you can focus on what you still have. And I think that's true in general. As sort of it's the cup half full, cup half empty. But I think the minute you learn in life, and I think it took this episode to make me learn the lesson well. The minute you kind of learn that it's choice you make, whether you dwell on gratitude about the blessings in your life, or whether you obsess on resentment over the ways in which your life falls short of other people's. That's a kind of fundamental psychological, emotional decision. Some people I don't think can make it because they have genuine mental health issues that don't turn that into a kind of choice. But learning to take the right turn at that intersection, I think, is everything. And also realizing, I think self-pity is a trap that a lot of people fall into. As soon as something rare like NAION, you're like, wow, this is so rare, why me? If you look in a kind of honest and open-eyed way at everyone around you and everyone you've met, you would be hard pressed to find anyone who wasn't dealing with something extremely difficult in his, her, their life. It's just not a lot of that stuff is visible. You don't know what's going on. People would say to me all the time, and maybe this is a good parting thought, well, I'm looking at you, your eyes look fine. It doesn't look like anything's wrong. Most of the most difficult things we all struggle with are not obvious to the people around us. And when something happens to you, remember that, because to pity yourself is to be kind of narcissistic, because yes, you have this thing to deal with, somebody else has something you don't know about that may be just as grave or more grave, and challenges and setbacks and limitations are not freak occurrences. They're the facts of life.
Mm-hmm. Now, that was so beautifully said, so eloquently said. You know, it reminds me, we had this conversation once, I think when you were preparing to write for your book, you had interviewed me and you asked me, because I have chronic migraine. And
Right.
there was a period in my life when I had migraine, like severe stabbing headaches every day for 4 years. And you asked me, you know, Dr. Banik, how do you go on with life with such severe stabbing headaches? And I gave you my perspective, which is, yes, I have this health issue, but I have to look beyond myself and tap into other aspects of who I am and let them rise to the occasion, and not let my migraine get me down and prevent me from doing all those things where I could be of value to others. And I always keep that in my mind. Like, again, anyone who's listening, if you've had a health challenge, think of all the other positive things in life and focus on those. I know it's easier said than done. Thank you so much, Frank, for spending this time with us. If anyone wanted to find out more about you, perhaps about your writing, your books, your column, what you're up to lately, how can they find you?
I have a website, frankbruni.com, that has a lot of that stuff. And it has a link to, I do a weekly newsletter for the New York Times, and on my website, there's a link to how to sign up for that. So that's probably the
Okay,
best way.
wonderful. So we'll share that in the show notes. Well, thank you so much again. Thanks for being part of the IQ podcast.
Thank you for everything you've done over recent years and everything you're doing through this podcast and through your practice.